As we told you earlier, the FDA is asking the makers of 10 antidepressants to add a warning to the drug's label.
Those labels would state that patients should be watched for signs of suicide. A Utah mom is thrilled with that decision, but some doctors are concerned. Details coming up in an ABC4 Health Alert.
You're watching ABC4 News at 5:30.
Welcome back. The FDA made a controversial recommendation today.
One that affects millions of people, thousands here in Utah. ABC4's Lisa Conley joins us now with more on this ABC4 Health Alert. Lisa?
Yeah. Barb and Randall, the FDA is asking the makers of 10 popular antidepressants to put warnings on their labels that people who take them should be closely monitored for warning signs of suicide. Labeling advocates are thrilled, but some doctors say the results could be disastrous.
Nearly 4 years ago, Ryder lost her youngest son. 14-year-old Kevin put a gun to his head and killed himself.
In my heart. I mean, I knew my son, and he was not a suicidal child.
Dawn blames Prozac. The drug was prescribed to Kevin after he showed signs of depression.
He was already showing adverse reactions to the drugs. The doctor just upped it. And this is what we see in a lot of these cases. They want to keep blaming the underlying depression, and they don't even look at the possibility that it could be the drugs that are creating, further problems.
The FDA knows about cases like Kevin's and today issued a warning. They're asking the makers of 10 popular antidepressants to put warnings on their labels, saying patients should be closely watched for signs of suicide. Drugs like Prozac, Paxil, Zoloft, and Lexapro are the drugs the FDA is most concerned could lead to suicidal behavior. But Utah psychiatrist George Nikopoulos says this warning could do more harm than good.
If somebody's on useful and effective treatment and suddenly goes off of it because of this report, then an increase in deaths might occur.
Dr. Nikopoulos cites study after study that shows the positive results of antidepressant therapy, even research done here on Utahns who committed suicide.
Doug Gray and some researchers at the university actually drew blood from these completed suicides, from 50 of them, and found 0 levels of antidepressants in their blood.
Still, people like Ryder say the FDA's warning is prudent and long overdue, and people should understand exactly what they're getting into with antidepressant therapy.
Now, the one thing Dr. Nikopoulos and Ryder both agree on, quitting these drugs cold turkey can be very dangerous. It's best to consult your physician and ask a lot of questions, Barb.
Thank you, Lisa. And for more information, all you have to do is log on to our website at abc4.tv.